you're not getting on the bandwagon, you better soon, because offering these procedures to men, it's no longer limited to what we used to think of men seeking, which for us was hair replacement surgery. Really is the only thing I did that consistently were men. And what they're still afraid of in general, I think Joe's touched on this appropriately, they're still afraid of surgery. They don't really want to talk much about surgery. It's interesting, there's some areas, like I said, with hair replacement, they're okay talking about that. In other areas, they're not so much.
I'm the single female on the panel talking about male aesthetic, but I think all of us are experiencing more and more men coming into our practice, so I love this topic. The gateway procedure, I would say in my practice, barring things like a little bit of toxin or an injectable, is doing IPL and photodynamic therapy. So I think for men that are a little bit reticent about cosmetics, this becomes something that we can treat more medically. We're treating, in the case of photodynamic therapy, we're treating precancerous spots. I would say the most common areas of men that I'm doing IPL is face, neck. I'm seeing a lot of poikiloderma of Savant, forearms and hands, and then occasionally scalp if it's a non-hair-bearing area. In that case, that's an area that I'll tackle as well.
So when you look at males, huge 50% increase in neuromodulators, 40% in minimally invasive procedures, 230% increase in fillers. So this is one of the fastest growing populations. It's only about 13% of my practice. So these are my most common male procedures: facelift, eyelid surgery, facial implants, spider veins, neuromods, and mole removal. So males are bigger, thicker skin, they require deeper anesthesia, they frequently have more intraoperative hypertension, and have a definite increased hematoma rate.
Male patients, they are about 25% of my patients. In Europe, normal male patients do not stand being modified. That means if you leave any kind of stigmata or any kind of marks, that is very badly looked at, and it will probably turn away all the rest of potential male patients from your practice. The only procedure that I have that combines these two necessities, it is not what I like most doing, but it's the most efficacious, and it is hyaluronic acid gel injections.